wonderful. We will have questions and answers at the very end. We also have Dr. Romain going to present after Dr. Marlin. So we will leave the questions at the very end. But thanks again for joining. Dr. Marlin, I'll leave it to you. Thank you.
Good afternoon. Thank you very much, Catherine, and happy Women's Day to everybody. And what is very interesting this year, it's year of equality, and I think if anything, COVID had showed how women are so unequal with men, and in a way, to a certain extent, women have to work like 3 or 4 times as harder as men to be able to reach or to cut the mustard in a man's world. And part of that, or the effects of that, it affects our fertility and everything. My special expertise and interest is actually gynae cancer. I was the head of gynae cancer for 8 years in the UK before coming here, and advanced laparoscopic surgery for endometriosis. And women with endometriosis suffer with premature ovarian failure and premature menopause. And I was trained in Oxford by one of the experts in menopause, Catherine Rees. And hence I have really this big interest in this topic. And it's really, really close to my heart. Premature ovarian failure is not actually premature menopause. Menopause is, the definition of it, is a woman not having a period for 12 months. However, premature ovarian failure is something that happens before the onset of the menopause, and it stops women from having babies. So basically, we as women are born with a certain number of follicles. We use these follicles along their life. Once we hit the age of 38, the number of follicles is low and they are old. They don't function equally well. Hence, the risk of miscarriage is increased, and the risk of or the chances of pregnancy drops down. Premature menopause affects 1% of the women, which means reaching the age of menopause period stopping before the age of 45. Premature ovarian failure, it affects 5% of the women between the age of 45 to 40. I think what is interesting, what I've seen since I came to Dubai in the last 4 years, is the premature ovarian failure. The incidence is much higher than what expected. Hence, from my point of view, is the awareness, because there is something we can do about that before the woman hit that period of her life. It's as early detection, and there is measures that we can take, and that's why it is something really close to my heart, and that's why I decided to talk about premature menopause and premature ovarian failure. It's not just fertility that is affected. There is the health risk associated with these problems. The health risk associated with the premature menopause, whether it's the risk of cardiovascular problems, the risk to early Alzheimer, our memory, our general well-being, our skin, the vaginal dryness, and women having problem with repeated vaginal infection, repeated urine infection. These are all the problems that we see in women who have premature menopause and premature ovarian failure. So what are the causes? What is very interesting, between 75 to 90% of women who reach the premature menopause, it's idiopathic, as there is no reason whatsoever. There is other causes like chromosomal abnormalities, such as X chromosome, fragile X chromosome, and the one name that pops into my head is Nicole Kidman. She has fragile X syndrome. These women are very beautiful, tall, and they hit premature menopause very early. The other cause of premature menopause is immunological, as the body attacks itself, and diseases that have immunological background is like Hashimoto's disease, the thyroiditis, as well as rheumatoid arthritis. So that's one other cause. The other cause is, surgical. Unfortunately, some women undergo surgery for cancer, they have their ovaries removed, or actually they need to have chemotherapy. And, there is more and more children who are undergoing chemotherapy and cancer treatment at early age, which causes premature ovarian failure. So this is, the other group of patients. What I see is the woman with endometriosis. Endometriosis affects 10% of the female population. The chocolate cyst, which is the endometriotic cyst present on the ovary, destroys the number of follicles that we have. In addition, unfortunately, having surgery to remove the cyst and being aggressive with the surgery can affect the ovarian reserve. And once we have loss of ovarian reserve, we don't regenerate new follicles, new eggs. Like men are lucky, they have new group of sperms produce every 63 days. Women, we just basically live with that number of follicles, and we utilize them through our life. The other things which I'm sure you are all aware, the environmental factor, and what we call is the aging factor, is the pollution effect on our eggs, the hormonal, pumped into the food that we eat, the pesticides, the living, the lifestyle, the stress, all that affects the ovarian reserve. So the question is, what can I do? What do I need to know? Is it important? And as you can see from what I've just mentioned, it is important to know whether we are hitting premature ovarian failure, so we can have our baby when we want to have, before we lose that chance. Especially women, we are following our career, we delay having babies until the age of 38, and suddenly, oops, the ovarian reserve is not really good and our chances is decreased. I mean, one point to mention, in the idiopathic group of ovarian failure, there is the genetic. It's good always to ask our mom how old was she when her period stopped, to make sure that we are well aware and well prepared. So there is tests that we can do to predict our fertility, to predict our ovarian reserve. The simplest test is the FSH-LH, which is a blood test that we do on day 3 of the period. The FSH level, which is the follicular stimulating hormone, which basically produced by the pituitary gland to give a message to our ovaries to produce a follicle. Usually it's released at high level on day 2, day 3, to promote the production of the follicles. And it should be less than 10. Once it reaches 8 and above, it means there is a compromise with ovarian reserve. However, this is not a very sensitive test. The most sensitive test for ovarian reserve is the anti-Mullerian hormone. It's really the most sensitive test. It's called AMH. Normally we do the 3 hormones all together on day 2, day 3 of the period. Our AMH should be more than 2.53 to say that actually we have a good pool of follicles on our ovaries and we don't need to panic from the point of view of poor ovarian reserve. Once it drops below 1, the chances of pregnancy is extremely low. So this is a topic close to my heart, because I see a lot of women who come and say, oops, nobody told me. I wish somebody have told me, I would have done something about it. Hence, here in King's, one of the things I've created is a fertility check-up package to allow women to do their test. These tests needs to be done on a yearly basis, because our ovaries are dynamic, they are a living organ, and things change. In addition to these hormonal checks, what we also can do is an ultrasound on day 4 or 5 of the period, and we count the antral follicles, and they should be above 8, and that usually says we have a good ovarian reserve. So there is other tests in theory that we can do. If woman hits the early menopause, the one thing we can do is we do chromosomal tests. We take a full history to see if we can find any other causes that can cause premature menopause and premature ovarian failure. The one thing that we need to mention is symptoms. Before our period stops completely, a lot of women, they start having a period coming every 2 to 3 months. Then 6 months later, their period regulates and then suddenly disappears again. And that's so typical of premature menopause and premature ovarian failure. Is we have symptoms, they disappear, then it's already, the ovaries fails completely. The other symptoms which we tend to have is the hot flushes, night sweats, mood swings, inability to eat, inability to sleep, weight gain in the wrong parts of our body, as the fat distribution, there is more in the belly rather than all over the body, the thinning of the hair, the vaginal dryness, the painful intercourse are all symptoms of lack of estrogen, which we see well before the menopause hits, well before the periods disappears. Hence, if we want to delay our fertility because of work commitment, we're pursuing a career, that's the right thing to do. However, we need to be aware of our ovarian reserve and be aware of the things that we can do to check that and make sure we are not surprised. So, as I mentioned at the beginning, the risk of premature ovarian failure is really high. The risk of osteoporosis, it's the risk of bone fractures, the risk to our cardiovascular system. I'm sure we are all well aware, extremely rarely women will have a heart attack under the age of 50, but once they cross the age of 50, which is the natural age of menopause, they are more prone to have heart problems, hypertension, diabetes, and heart disease, because the estrogen have a protective effect to our heart. The other risk, as I mentioned, the vaginal dryness, the recurrent vaginal infection, repeated vaginal infections such as bacterial vaginosis, repeated urinary tract infection, interstitial cystitis, where women have symptoms of water infection, however the urine test is not showing any infection, pain during intercourse due to vaginal dryness, decreased interest in intimacy. All of these things really develop well ahead before developing of the cessation of the periods completely. So it's not doom and gloom. Knowing is important, and I always say knowledge is power. Once we have the knowledge, then we know what we can do and how we can deal with it. It's not for all of us to have, not all of us wants to have children. Some of us would rather to pursue a career and not to have children. However, we don't want to be caught and be surprised when it's too late. Women nowadays are more aware of their options, and we are more talking about openly about egg freezing, and the technology is there for egg freezing or embryo freezing. What's the difference between egg freezing and embryo freezing? Egg freezing is usually mainly for women who don't have a partner, but would like to freeze her eggs because her mom had premature menopause, or she doesn't want to have a child, early on. So we collect the eggs, we freeze them. The embryo freezing is when a woman have a partner, and basically we put the eggs and the sperm in a plate, they fertilize, and then we freeze these embryos at the stage of 8 cells or something like that, and they can be frozen for years and years, and we can use them whenever we need to do that. The technology, even in the UAE now, is licensed for women who don't have a partner, while in the past women have to be married to freeze their eggs, and the technology is available now. And I have a lot of my endometriosis women. The problem with the endometriosis women, their ovarian reserve is really, really damaged by the chocolate cyst on the ovaries. That damages the ovary, and as well the surgery damages the ovary further. Endometriosis is an inflammatory disease that basically causes period pain, and period pain is not normal. It also causes heavy periods, bleeding in between the period, bleeding after intercourse. So it have multiple presentations, and I always say, don't ignore pain, don't ignore abnormal bleeding, don't ignore irregular period. Seek advice, seek an expert assessment. Make sure that you will have an ultrasound done, you have your hormonal assays done, and you have a fully check-up. In addition to the freezing the eggs, as like basically saving money in the bank, that's the best way to look at it, is we definitely need to treat women who reach the early menopause with hormone replacement treatment. The hormone replacement treatment is not something to be frightened from. It is have a lot of advantages. So the American Woman study really had given a bad reputation to the hormone replacement treatment. Unfortunately, it was a poorly designed study which showed increased risk of cancer, increased risk of heart disease and blood clots, and this study was flawed from the beginning. All the recent data showing estrogen is protective for the heart, especially if you are using it for women who are young, because what we are doing is we are replacing the normal hormonal produced by the ovaries. They are not there, and we are replacing them with a tablet or a gel or a vaginal tablet. The risk of breast cancer is extremely small, and the best way to look at it, the risk of breast cancer is 37 in 10,000 women if they never ever use hormone replacement. If they use the hormone replacement for 5 years, the 37 women will go up to 42. That's an extra 5 women. That's nothing in 10,000. If they use it for 10 years, it goes up by extra 10 women in 10,000. So the numbers are really small, but that risk does not really exist for women who are young. As I said, because we are replacing the natural hormonal. The sad news is, even with hormone replacement for women who reach the premature menopause, we can't eliminate the complete risk of cardiovascular problems. However, we can decrease that risk by lifestyle changes, healthy eating, exercising, having regular checkups, having your pap smears, breast ultrasound, mammogram on a regular basis. And what is interesting, a recent study only in the last couple of months published by the WHO showed that women who use HRT are at lower risk with breast cancer. Not they are at lower risk of developing breast cancer, it's actually we are picking up so early their breast cancer because they have regular checkup. We don't prescribe HRT without seeing a woman. We check them every 3 months. We check their blood pressure, their weight. We make sure they are up to date with all the screening tests, such as the pap smear and the mammogram. Hence, it's very protective. The other treatments, for women with immunological problem causing the premature menopause is corticosteroids and other immunomodulator. It does not really get them back to normal. However, it stops the deterioration of the ovarian function. So that is a really important factor to take into account, and that's why it's important to diagnose. The other thing is alternative supportive treatment. For premature menopause is of no value whatsoever. Sorry about that, there is somebody knocking on the door. There is no value of supportive treatment as an alternative to hormone replacement. Definitely there is a value for taking multivitamins, for making sure that our vitamin D level is completely normal. We take vitamin D because especially in this country we don't see the sun. At the same time, for hot flushes, one of the things that can help us with hot flushes is a sage tablet. It really improves the hot flushes. Using menopause tablet as supportive with vitamin B complex. So these are things that are of value as supportive, but not as of alternative treatment. So the other really most recent advances in premature ovarian failure, and definitely I'll have to mention it, it's stem cells. So what is the stem cells? The cells in our hearts or skin, it's called differentiated cells. The stem cells is the undifferentiated cells in our body, and basically they eventually differentiate into any type of cells in our body. The technology is very advanced in treatments for leukemia, certain cancers, and we collect the stem cell from the cord blood of the newborn baby, the cord itself and the placenta, and we store them and freeze them. However, we have stem cells in our fat, in our bone marrow, which we can collect, harvest the stem cells, and grow them in the lab, and then inject them in different places. At the moment, we are using it for knee problems or joint problems. The technology is really still early. And the other uses or potential uses is harvesting the stem cells from the fat and injecting them in the ovaries to help with premature ovarian failure. The technology is not yet 100%. There are some studies which basically showed potential benefit, as 20% of the women, their period had come back and 10% got pregnant. But when you look at the data in details, it's only out of 120 women who the study, they were included in the study, only 10 women qualified, and out of these 10 women, one of them only got pregnant and the other one, her period had come back. However, watch this space. This technology is progressing very quickly, and this is one really one of the potential advances for us in the future. So in summary, if your period is abnormal, is irregular, you have heavy period, you have painful period, it is important to have a full checkup. On the other hand, if you are not ready to have a baby at any point, early in your life, and you think you will be ready at the age of 35, 37, 38, or even after that, it's worth considering regularly having a fertility check and considering as well egg freezing. So I kept my talk short and sweet because I would like to have questions at the end. Thank you very much.
Dr. Marlon, thank you so much for